understanding the benefits and side effects of this blood pressure medication. High blood pressure, or hypertension, is a common medical condition that affects millions of people worldwide. Left untreated, it can lead to serious health complications such as heart disease, stroke, and kidney problems. Atenolol is one of the many medications available to manage hypertension. This article explores the benefits, potential side effects and drug interaction of atenolol as a blood pressure medication. Benefits of atenolol. Atenolol is a beta blocker, a class of medications that works by blocking the effects of adrenaline on the heart. Blood pressure control. Atenolol is a beta blocker, a class of medications that works by blocking the effects of adrenaline on the heart. This leads to a slower heart rate and reduced force of contraction, which in turn helps to lower blood pressure. By decreasing the workload of the heart, atenolol can effectively manage hypertension and reduce the risk of related cardiovascular issues. Cardiovascular health. In addition to lowering blood pressure, atenolol has been shown to have several cardiovascular benefits. It can help stabilize heart rhythm, making it an effective treatment for conditions such as atrial fibrillation and ventricular tachycardia. Furthermore, atenolol is often prescribed to individuals who have had heart attacks or are at risk of one, as it can reduce the strain on the heart and improve its overall function. Migraine prevention. Some individuals who suffer from recurrent migraines find relief in atenolol. While the exact mechanism is not entirely understood, atenolol can reduce the frequency and severity of migraines in some patients. This off-label use can be particularly beneficial for those who have not responded well to other migraine treatments. Anxiety and tremor management. Atenolol can also be prescribed for anxiety-related conditions, especially in cases where physical symptoms such as tremors and a racing heartbeat are prominent. By reducing these physical symptoms, it can help individuals manage their anxiety more effectively. Side effects of atenolol. Fatigue and dizziness. One of the most common side effects of atenolol is fatigue or dizziness, particularly when standing up quickly. This occurs because the medication can lower blood pressure and reduce blood flow to the brain. It is essential to adjust the dosage or timing of the medication in consultation with a healthcare provider if these side effects are severe. Cold extremities. Atenolol may cause peripheral vasoconstriction, leading to cold hands and feet in some individuals. This is due to the medication's effect on blood vessel constriction. While not generally harmful, it can be uncomfortable. Depression and mental health concerns. Some patients have reported experiencing mood changes, including depression or vivid dreams, while taking atenolol. It is essential for individuals with pre-existing mental health conditions to discuss this potential side effect with their healthcare provider. Adjustments to the medication or alternative treatment options may be necessary. Bronchospasm. Atenolol should be used cautiously in individuals with a history of asthma or chronic obstructive pulmonary disease, COPD, as it can worsen bronchospasm and breathing difficulties. Masking hypoglycemia. Atenolol can mask the symptoms of low blood sugar, which may be a concern for individuals with diabetes. It is crucial for those with diabetes to closely monitor their blood sugar levels and work with their healthcare provider to adjust their treatment plan if necessary. Hypoglycemia can be fatal if not detected and treated quickly. Drug interactions of atenolol. Other antihypertensive medications. Combining atenolol with other medications used to lower blood pressure can lead to an additive effect, potentially causing excessive blood pressure reduction. It's crucial to monitor blood pressure carefully when using multiple antihypertensive drugs. Calcium channel blockers. Taking atenolol with calcium channel blockers, such as verapamil or diltiazem, can enhance the reduction in heart rate and blood pressure. This combination can be beneficial in some cases but should be closely monitored by a healthcare provider to prevent excessive bradycardia or low blood pressure. Alpha blockers. Combining atenolol with alpha blockers, like doxazosin or prazosin, can lead to an increased risk of low blood pressure and orthostatic hypotension, dizziness upon standing. Dosage adjustments may be necessary. Nonsteroidal anti-inflammatory drugs, NSAIDs, some NSAIDs, like ibuprofen and naproxen, may interfere with the blood pressure lowering effects of atenolol. It's essential to use NSAIDs cautiously, especially if you have hypertension. Consult with your healthcare provider for pain management alternatives. Medications for diabetes. Atenolol may mask the symptoms of low blood sugar, hypoglycemia, in individuals with diabetes. If you're taking atenolol and medications for diabetes, such as insulin or sulfonylureas, close monitoring of blood sugar levels is crucial. Dose adjustments may be needed to maintain proper glucose control. Sympathomimetic agents. Medications or substances that stimulate the sympathetic nervous system can counteract the effects of atenolol. This includes drugs used for asthma, for example, albuterol, or certain cold and allergy medications. Combining atenolol with sympathomimetic agents may reduce the heart rate lowering effects of atenolol and should be done with caution. Clonidine. Using atenolol with clonidine, a medication commonly prescribed for hypertension, can lead to a rebound increase in blood pressure if clonidine is stopped suddenly. If you're on both medications, it's important to follow a specific protocol for tapering off clonidine, under the guidance of a healthcare provider. Alcohol. Drinking alcohol while taking atenolol may increase the sedative effects of the medication. It can also lead to orthostatic hypotension, so it's advisable to limit alcohol consumption, and be cautious when standing up quickly. This list is not exhaustive, and there may be other drug interactions with atenolol that are not mentioned here. Always provide your healthcare provider with a complete list of all medications, supplements, and over-the-counter drugs you are taking to ensure your safety and the effectiveness of your treatment. Regular monitoring and open communication with your healthcare team are essential when using atenolol or any other medication. Atenolol is a valuable medication for managing high blood pressure and has several potential benefits for cardiovascular health, migraine prevention, and anxiety management. However, like all medications, it comes with potential side effects that should be carefully considered. The decision to use atenolol should be made in consultation with a healthcare provider who can assess the individual's specific health needs, taking into account both the benefits and potential risks associated with this medication. Regular monitoring and open communication with a healthcare professional are essential to ensure the safe and effective use of atenolol as a blood pressure medication. There is a video link above which may help your health. Thanks for watching. If you learned something, please give me a thumbs up and subscribe.